Americans have Stockholm Syndrome. Think about it. When we buy into the myth that universal healthcare somehow won't work better than what we have, despite it working better than what we have all over the world in countries with higher life expectancies than ours, spending half as much as we do on healthcare, we essentially defend our broken and exploitative healthcare system that is designed to be profitable, not to heal people. Their business model is literally about denying claims. We're the only country in the world where millions are in medical debt, where people file for bankruptcy because of medical bills, where insurance companies can't get on the same page as providers and no one knows what's going on. And the fact that most people have insurance through their employer is another cruel part of the equation, keeping millions of jobs they hate but they can't afford to lose their insurance. Spoiler alert, we're already paying for universal health care, and then some. Federal, state, and local governments spend over $8,500 per person each year on Medicare, Medicaid, and other public programs. That's more than Germany and the Netherlands spend per person for their entire universal systems. But wait, there's more. We're going to spend over $700 billion on prescription drugs this year, more than twice what other countries pay, a number that could get knocked down significantly if we let drugs be sold without patent monopolies. $1.5 trillion annually in employer and worker premiums to private insurers, $350 billion just for administrative costs, accounting for 25% of what they pay out versus the just over 1% for the administrative costs of Medicare. Now there's an interesting difference. When top healthcare executives get tens of millions of dollars per year and top administrators in Medicare get a bit over $200K a year, think about the system we're defending here. You talk about waste. There are also enormous indirect costs apart from what's paid directly to insurers. Hospitals and doctors' offices have to spend massive sums of money hiring staff to deal with all the different rules and forms of all the various insurance companies. So are we still buying into the "that's socialism" boogeyman? Or are we just comfortable in our chains and the bureaucratic torture?